first guest is Dr. Elaine Alexander, who is a rheumatologist. Well, let's start off by just kind of telling us what is a rheumatologist.
Well, in general, we're physicians who treat arthritis, and so that can range from anywhere, osteoarthritis or rheumatoid arthritis. Usually inflammation or pain in your joints of your hands, your feet, knees, that type of thing.
So rheumatology deals a lot, you use the term arthritis. There are different types of arthritis that affect different people different ways. Mm-hmm. Tell me a little bit about them.
The most common type of arthritis is osteoarthritis or wear and tear arthritis. That basically it affects almost all of the aging population. We're seeing even more now that people are living longer and more active. That is not an inflammatory type of arthritis. It's just something, it's wearing down of the cartilage. That is something that plagues a lot of people and a big health issue.
In our practice, I see a lot of people with osteo or wear and tear. Mm-hmm. A lot of it's knee arthritis or larger joints, but I guess you can get osteoarthritis in any joint. And is it always old people, or is it sports people get that similar type of arthritis too?
Definitely, it can occur in more middle-aged, even some younger individuals, depending on different things that they have going on. So especially if you're very active, you're in sports, in your teenage years or as a child, you can have some early arthritis depending on injuries and things like that.
And then there's rheumatoid, which is an inflammatory arthritis. Tell us how that occurs.
Yeah, so rheumatoid arthritis is a type of autoimmune disease, and it actually causes inflammation in your joints. It's a little bit different from the wear and tear arthritis that we have. It tends to kind of come on. It can come on as a younger person, in the teens or 20s, or actually come on even as an older person.
And you use the term autoimmune. Tell us what that means.
For whatever reason, we don't know why, something gets turned on in our bodies, and some of our immune fighting cells, so our infection fighting cells, will attack some of the lining of our joints. And so that actually causes a lot of pain and inflammation and swelling and things like that.
So when somebody has arthritis and they end up in your office, there's some treatments you can do. Tell us about some of the medications you use.
So probably our bread and butter number one go-to medicine, our medicine's called NSAIDs, and those it stands for non-steroidal anti-inflammatory.
What are some examples of those names that
so
somebody might recognize?
Common ones: ibuprofen or Motrin, Aleve, naproxen, those types of things. There are many different classes and types of NSAIDs, and so some work better for inflammation than others.
Well, a lot of times when I see a patient in my office, they'll have already tried Aleve or Advil, and they'll come see me, and I'll try some of the prescription anti-inflammatories, and it's still not working, and they end up in your office. So are there other newer type medicines other than the anti-inflammatories?
Definitely. So depending on the type of arthritis you have, if it's more the wear and tear arthritis, we do have several different types of medications that target nerves and things to help with pain. We don't really have any medicines that halt the progression of osteoarthritis. However, on the other side, with the inflammatory arthritis, should you have one of those, there are some different kinds of medicines that actually get to the root of the problem and kind of calm down the immune system, and those are called DMARDs. Some examples of those are methotrexate. It's a very old kind of chemotherapy type drug. Plaquenil, and the list goes on and on. I don't know.
All right. Well, if you have arthritis, you may end up in the rheumatologist office with some medication like we just talked about. We'll be right back.